In today's Health Alert, new research shows a common over-the-counter drug may have significant benefits for people with colon and rectal cancer. A clinical trial suggesting daily aspirin use could cut the risk of cancer coming back by more than half. Our chief health editor, Dr. Partha Nandi, joining us now. And Doc, you must be happy with these results. What more can you share about the study?
It's exciting stuff for me. I see a lot of patients with this type of cancer in my practice, and this study, to me, offers real hope for these patients. Now, these researchers followed more than 600 folks from 33 hospitals in Sweden, Denmark, Norway, and Finland, and they all had colon and rectal cancer, and they had this P1K3 gene mutation. These genes usually help keep cell growth and division in check, but if they become dysregulated, well, the cells can grow unchecked, leading to cancer. So before treatment started in the study, the patients had surgery to remove their cancer, and then they were randomly assigned to take either a placebo or a 160 milligram aspirin pill every day for 3 years. And here's what they found out. Those who took aspirin had a 55% lower risk of their cancer coming back compared to those who didn't. And that's a big deal because 30 to 40% of colon cancer patients face a recurrence, and once it spreads, the disease is really much harder to treat. So it's encouraging to me that something as simple as aspirin, which is widely available, inexpensive, could offer real protection for a select group of patients.
Pretty high numbers. So how does aspirin influence the risk of reoccurrence and any side effects?
Yeah, the side effects are big time, right? So the researchers aren't exactly sure why aspirin cuts the risk, but they believe it works through several pathways. And so number one, it lowers the inflammation in the body, thins the blood, and slows tumor cell growth. Now together, these effects make it harder for these cancer cells to survive and then spread. Now, we do have to talk about the side effects. This is important. Aspirin has been around for over a century, but it is not risk-free. In this trial, in fact, Simon, serious side effects were seen in 16.8% of patients taking aspirin compared to 11.6% of the people taking the placebo, quote-unquote, the sugar pill. Of those potentially linked to aspirin, 4 patients experienced serious issues like stomach or intestinal bleeding, allergic reactions, and even bleeding in the brain. So listen, the benefits are promising, but please do not start aspirin therapy on your own. In my opinion, larger studies are needed before aspirin becomes a standard treatment. And if you have colon cancer or rectal cancer, please talk to your doctor, maybe get genetic testing before considering aspirin. But still, having said all that, I think it's a great tool. It's simple and inexpensive and may reduce your risk of recurrence if you have colon cancer.
Like you said, everyone has different circumstances, but this is certainly powerful, what they're finding now.
100%. Colon cancer is number 2 or 3 cancer killer in the country. So anything we can do to stop it would be great.
Okay, Doc, thanks a lot for being
here. Hey, my
here.
pleasure, of course.
And this week on the Dr. Nandi Show, the unexpected benefits of yoga. Dr. Nandi talking with a guest who says she saw fewer asthma symptoms, less stress, and even fewer colds after doing yoga. Tune in this Sunday at 5 p.m.